Lately, we've been seeing a lot of patients walk in with sinus infections. Not only do they walk in with them, but my staff is always fielding phone calls with patients calling saying, I think I have another sinus infection. What's going on? Sinus infections are actually quite interesting because over the years, they've been associated with a bacterial infection in the sinus cavity, and they've gotten worked up that way where most patients will then get thrown on an antibiotic. And here's the problem. It either doesn't eradicate it or it doesn't work, or it seems to work and go away, but then the patient says they're on their second, third, or fourth sinus infection over the course of a season. In my clinical experience, I have noticed that it's not really that those sinus infections are going away. They're actually the same sinus infection. We're just driving down a lot of the symptoms using an antibiotic that never really goes away, and then once that antibiotic is removed and the patient continues their life, a few weeks later or even a few months later, it seems to rear its ugly head again, and they're back with that same chronic sinus infection. What's interesting when you dive into the literature is we now know that a lot of sinus infections are actually fungal in nature, not bacteria related. So an antibiotic theoretically wouldn't work for those patients. We need to start looking at fungus and using something that is more broad spectrum and antifungal in nature. And we have a whole line here at Innovative that we use, ranging from products called biocidin to things like caprylic acid that specifically will fight a fungal infection, or even a broad spectrum product that'll have multiple herbs in it, like caprylic acid, like oregano, like grapefruit seed extract, all sorts of things that can help fight that sinus infection. What's also interesting though is if there is sinus infections that are a result of yeast or fungus, they're not only just in the sinus cavity, but because yeast or fungus likes warm, moist places, we might find them elsewhere in the body. We might find them in women vaginally, we might find them in folds in people who are a little bit more overweight. We might find it under fingernails, especially because moisture gets trapped in there, and we certainly see a lot of it in the gut as well. So sometimes we actually have what's called a systemic problem of yeast, where it's not just localized to the sinus cavity, but it's throughout the entire body. And then we have to start look at not only treating through supplementation, but also looking at nutrition and diet and things that can commonly feed yeast. So for those of you with a sinus infection, take a look at what you're eating. Are you doing a lot of dairy? It's very mucus forming. You may want to cut out dairy products for a few weeks and see if you get some decrease in symptoms. We also see things like alcohol, other products with yeast, melons, peanuts, olives, mushrooms, and other food items that can contribute to this problem as well. So if you're struggling time after time with chronic sinus infections, there's absolutely an answer. We'd love to help you with that, get to the root cause of it. Rather than just treat it, figure out what's stimulating that overgrowth, whether it is bacterial or fungal, and get rid of it once and for all.